Okay. Well, you can try. Otherwise,
Hello, everyone. Welcome to Demystifying Medicine YouTube channel, Interview on Iron. Today we have Dr. Veronica Moncalvo, an assistant professor at McMaster University in the School of Interdisciplinary Science. She teaches different undergraduate life science courses, one of which is human nutritional toxicology, where we study how certain nutrients can be toxic to us if taken in extremely low or high amounts. In this course, students learn about the requirement of essential metals. Essential metals are the metals such as iron, zinc, or copper, which we require in our diets for the proper functioning of our bodies. Let's look deeper into iron. Why is iron so important for us?
iron is required for many biological processes, including the synthesis of hemoglobin, an important protein found in red blood cells and whose function is to carry oxygen in blood. Iron also helps with the storage of oxygen in muscles via the action of myoglobin and is also required for producing ATP, which is the main source of energy for cells.
Does everyone require the same amount of iron?
That's a good question. Actually, the requirement of iron intake depends on many factors, two of which are age and gender. During puberty, when our bodies go through growth spurts, the demand of iron is higher, for instance. Also, premenopausal women who undergo menstruation lose blood and therefore with it iron. Therefore, they also need extra iron to stay healthy. Women who are pregnant require more iron as well to compensate for the additional demand from the baby.
How much iron should one consume on a daily basis?
That's important also to know, and it's a good question. So while most iron is normally recycled from red blood cells, we do need to compensate from small losses by intaking some iron from our diet. So that's something to keep in mind. On a daily basis, men and postmenopausal women require about 8 milligrams of iron every day. However, women undergoing menstruation, as mentioned earlier, require a bit more, around 18 milligrams a day, and during pregnancy women need around 27 milligrams a day.
What are some good dietary sources of iron?
Well, some common sources of iron that we are all familiar with are meats, eggs, legumes, such as lentils, for instance. And it's important to consider that not all iron is created equal. In fact, there are two types of iron in our diet. One of them being heme iron, which can be easily absorbed by our bodies and found mostly in meat, and also non-heme iron, which is usually found in plant sources. Unfortunately, non-heme iron is not as easily absorbed as heme iron by our bodies. This means that the bioavailability of these two forms of iron is not the same.
Is non-heme iron not useful at all?
A non-heme iron is still a useful source of iron, especially for people with dietary restrictions who cannot consume certain meats or animal source foods. It just means that all the iron quantity present in the non-heme iron product won't be absorbed, but still some of it will, and therefore is useful.
How to improve the absorption of non-heme iron?
Yeah, that's also an important question and something to keep in mind, especially for people with those dietary restrictions. Anything that is, for instance, acidic, such as vitamin C, enhances non-heme iron absorption. So, drinking a beverage like orange juice, for instance, while consuming non-heme iron will be beneficial. On the other hand, beverages like coffee and tea contains phytates, which prevent the absorption of non-heme iron. So, so you would not necessarily want to drink those kind of beverages along with nuts or seeds if the goal is to get more iron. Also, some unprocessed whole grains and even spinach has the same problem. It inhibits iron absorption. And it is ironic because spinach is a well known source of iron, but at the same time, it actually prevents our body from absorbing some of that iron.
What exactly is anemia?
When we think of anemia, we often associate it with lack of iron, but it is not as simple as that. Anemia is a decrease in the number of red blood cells or decrease in the concentration of hemoglobin in blood. And there is one type of anemia that is called iron deficiency anemia, that is one of the most common ones, that, as the name implies, it is caused by a deficiency of iron in our body due to, for instance, not consuming enough iron from our diet, or, for instance, due to extreme loss of blood. Thus, people feel weak and they have low energy because this low iron in blood results in not enough oxygen reaching our organs. The best way to treat, for instance, this type of anemia is by taking oral supplements prescribed by our doctors, and in some cases, administer iron intravenously. Interestingly enough, there are some type of anemia, such as, for instance, thalassemias, that happen even when there's an excess amount of iron in our body. In fact, these types of anemias are usually referred to as iron-loading anemias, because one of the side effects is accumulation of iron in our liver and other organs. These types of anemias are due to defects in red blood cell or hemoglobin production.
Thank you for chatting with us, Dr. Veronica Moncalvo. Do you have any comments for the viewers?
Well, I think hopefully you realize how important it is to always try to eat a healthy and balanced diet and be aware of and learn whenever we can about the nutritional value of what we eat. So I hope you found these chatting fun and learn a bit more about essential metals today.
Don't forget to watch Demystifying Medicine YouTube channel for more videos.